There is a mismatch between what matters to patients and what is being measured. This contrast can be best demonstrated based on this large scale study of metastatic breast cancer patients in the Nordic region. On the right hand side is the measurement that is being evaluated or reported by the country's hospitals and the registry for breast cancer. And what are these? So there is outcomes or measurements that look at mortality, complications, relapse, satisfaction, waiting times for diagnosis and treatment, preoperative diagnosis, tumor data, surgery technique. This is what is being reflected, reported, and measured. However, when the patients were asked what are the criteria that matters to them most to these metastatic breast cancer patients, and if you only look at those criteria to which the patients responded as serious or very serious, meaning important or very important, these criteria were worrying about the future and anxiety about what lies ahead, 44%, fatigue, tiredness, and confusion about what needs to be done, issues surrounding economics, money, payment, insurance, challenges with nutrition, diet, ability to just move around, whether it's lifting, climbing, or walking, being physically active, anxiety about family, children, friends, sleep-related problems, probably due to chemotherapy-induced neuropathy, disruptions and changes in day-to-day life, other pain, physical discomfort, probably due to radiotherapy, surgery, etc. So what you can see is what really and truly matters to these patients is inadequately reflected or not measured at all. And as we explored the idea of value in terms of not just operational metrics or measurements, not just in terms of clinical outcomes or physician reported outcomes, but also patient reported and what matters to the patient the most. So therefore, from a patient perspective, we could look at the value equation as equal to value for a patient as equal to quality, which can be measured as outcomes, both clinical and operational, and patient reported, and service, which is patient experience, divided by cost, both direct and indirect. And measuring this value means measuring outcomes that are important to patients as well as those metrics that doctors find clinically relevant and important. And all of this delivered at the right place, at the right time, in the right context to the right patient. The costs, of course, ideally should be measured using time-dependent or time-driven activity-based costing, ideally. Now, this equation seems good, noble even, looks elegant, but there are challenges in mathematically quantifying patient-reported outcomes. It's not perfect. The point I'm trying to make is that including patients' requirements or even acknowledging these metrics and having doctors talk about what to expect and what the patient demands will probably expand the way we understand and improve patient experience.